Well, the vaccination drive for teachers officially kicking off today. In fact, later this morning, Basic Education Minister Angie Motshekga and Gauteng Education MEC Panyaza Lesufi are going to launch the program in Tembisa. We'll bring that to you live about 7:30 this morning. Other stakeholders from the sector, including teacher unions, are expected to join the minister and the MEC. Motshekga will proceed to visit other vaccination sites in Soweto and also the Vaal. 582,000 people in the sector are planned to be vaccinated over the 14-day period. The vaccine drive will wrap up on the 8th of July, just before the end of the second term. We spoke about the Gauteng Education MEC, Panyaza Lesufi, of course. He says additional sites have been allocated for teachers to avoid any kind of overcrowding. He says he's confident the rollout plan will be a success.
What we have done, we've, together with the Department of Health, identified sites across the entire province. So each and every site, we've done what we call mapping, school mapping, which simply means we link that site with the number of schools that are closer to that site. So what they need to do is just contact their principal, and their principal will tell them where to go. It has to be done in an orderly manner because we don't want to disrupt the academic programs, which simply means that it will be managed in a manner that is rotational, so not everyone will leave the school premises at the same time. Immediately after that, when they arrive at the site, they just need the ID, a copy of the ID or the driver's license, and if they've got the medical aid card as well, because some of the medical aids have an agreement with government to ensure that this information is collected for their members. So that's basically that, and I'm told it lasts not more than 5 minutes. Immediately after that, they will be escorted. Just wait for 15 minutes or so to check whether there are after effects or not. If there are no after effects, they will go back to school, and if there are after effects, then the medical team will provide the relevant assistance. There are additional sites for educators, exclusively for educators. Yes, in some instances, the sites that we're utilizing, we're sharing them with the 60-year-olds or above. The numbers of the 60-year-olds are going down because the majority of people have been covered. So it's not going to create any stampede or create confusion. All those that will be on that particular site, they'll be guided accordingly by the marshals.